Welcome to the Johns Hopkins Medicine online webinar series. Today, Johns Hopkins expert Cosimo Perret will be speaking about young adult kidney transplants, understanding the transition of care. Before we get started, we'd like to provide some user tips so that you are comfortable using this platform. The first 30 minutes of our program will include an informative presentation by our presenter. The last 30 minutes will be dedicated to our live Q&A session. Please note this program is being recorded. To submit a question, please type your question into the Q&A box and click send. Your questions will be seen by others watching this presentation, so please note if you do not want your name attached to your question, please check send anonymously. Also, your email address will not be shared with any third parties. We will do our best to answer all questions we receive during the Q&A session. Alternatively, you can email us questions and feedback to hopkinsseminars@jhmi.edu. At the end of the webinar, we would greatly appreciate receiving your feedback and ask that you complete our survey. A pop-up window will appear at the end of our program for you to complete the survey. And now I would like to welcome Dr. Perret to begin our presentation.
Good afternoon, everybody. I'm Dr. Cosimo Perret. I am an assistant professor of pediatrics here at Johns Hopkins, and I'm excited to talk with you today on this seminar. I am a pediatric nephrologist here and have particular interest in supporting our patients and families around transition of care. And so today I'm going to talk with you about understanding transition of care, particularly as it relates to our young adult kidney transplant recipients. So I'd like to start off with some objectives first. I think before we delve into our specific program here, it's a great idea just to define what transition of care is and what it means. We're going to go over some current recommendations regarding transition, and then I'll discuss our particular Hopkins transplant transition program and our goals, and then highlight a lot of the program. And we're going to hear a little bit from one of our patients as well. So what is transition of care? There are many definitions that exist. Those of you familiar with this concept may have your own that you like. This is one that I find particularly relevant, and that it describes transition of care as being the purposeful, planned movement of adolescents with chronic physical and medical conditions from a child-centered to an adult-oriented healthcare system. Many of you may recognize that transition is a process. It's not a single event. And so it's a process that starts quite early. And I'm going to go through that a little bit today, as early as the age of 11. The transition process plays a critical role in how adolescents and young adults will engage with health services during their lifetime. So transition is really one that focuses on promoting engagement and teaching self-management skills that are going to serve these particular individuals throughout their lifetime as they engage with multiple healthcare providers. There are many recommendations out there about transition. It is certainly a very hot topic now, as it has been for the last several years. Many organizations have provided recommendations or guidelines about transition of care, and I'd like to draw your attention to a couple of these. So the American Academy of Pediatrics, the American Academy of Family Physicians, and the American College of Physicians have really prioritized transition. In 2018, so just a couple of years ago, there was a clinical report that was published as a joint effort between all of these groups that was entitled Supporting the Healthcare Transition from Adolescence to Adulthood in the Medical Home. It's quite a lengthy clinical report, and I bring that up because in order to emphasize that transition is quite comprehensive, and there's a lot of details that need to be considered in order to do transition well. And this report really highlights a lot of those, and so I think it's a great resource that many of us within pediatrics certainly look to help guide our particular transition programs. As it specifically relates to patients who have undergone transplantation, the American Society of Transplantation has recently, in the last couple of years, really focused on developing some guidance around transition. And they have a wonderful transition portal on the American Society of Transplantation website that, again, nicely outlines the goals of transition as it relates to those patients who have undergone transplantation, and provides some great guidance for us as providers about creating our own programs, as well as a lot of patient and family focused information and education. So another great resource. So here at the Harriet Lane Kidney Center at Johns Hopkins, we developed our own transition program many years ago. So back in 2006, we organized a multidisciplinary team to come together to really start to think about how we could best support our patients and families as they go through transition, as they go through adolescence and young adulthood. In 2006, our group, the group that started out included physicians, there was a lead nurse, a social worker, and then we had a pharmacist who joined our team a little bit later. And this group really wanted to design a transition training program to help support our patients and families. And this continuum of training modules that was developed by our group was intended to be used in clinic to, again, promote self-management and promote patient engagement. So again, those two very important concepts at the root of transition. We started this program officially in 2008 and enrolled patients ages 13 to 21 who had chronic kidney disease, those who had end-stage renal disease or ESRD, including those patients who were on dialysis or those who had undergone or were preparing for transplant. So I mentioned we started this program in 2008 and have had many patients and families go through this transition program, and many who have successfully transferred to the adult side, and have enrolled over 100 patients so far. Many of these are still actively involved in our transition program. So with that program in place, we became more interested in developing a transplant-specific transition program. And so that led to the development of the Johns Hopkins Transplant Transition Program, which is what we have in place today. Under the umbrella of the Comprehensive Transplant Center here at Johns Hopkins, we came together as 3 separate groups focused on solid organ transplantation. And so the kidney transplant, the pediatric kidney transplant group, the pediatric liver transplant group, and the pediatric heart transplant group came together to collaborate and create a transition program suitable for all of these patients. So we have a very robust multidisciplinary team that is focused on developing this program and now focused on continuing to implement this program. This multidisciplinary team included many members. I think the most important, though, being patient representation. So we have a patient representative who has successfully transferred to the adult side and who has been incredibly valuable in providing feedback about their program during the development as well as the implementation. And so I would argue that that's probably our most important member of our team. We have physicians as a part of this team, nurse practitioners, transplant nurses, social workers, dietitians, pharmacists, and behavior psychologists who's really focused on making sure that we provide support to help folks cope with the various things that they encounter through this transition process. Our entire team is very patient-centered, and we have always, and will continue to always take a very patient-centered team approach to transition. So I'd like to introduce you to the kidney transplant transition program team members. So you'll see myself there as the nephrologist, Renee Shoemate, our transplant nurse, who's been involved with transition for many, many years and was really the leader of the 2006 program. Allison Heward, our nurse practitioner, Elizabeth Goswami, our transplant pharmacist, Lana Horowitz, our social worker, Dr. Carissa Parrish, our psychologist, Sammy Shug, who's our nutritionist, and Elizabeth Bigelow, who's one of our office coordinators and helps to really keep the program up and running and make sure that we're staying on task with everything. So this is really a great group of folks that have come together on the focus particularly on kidney transplant transition. and works tirelessly to create this program as well as implement it and support all of our patients as they go through the program. So what are the goals of our transplant transition program? You'll see some general themes woven through here that go back to some of the definition and the other recommendations that I shared with you a moment ago. Our program is really focused on supporting and empowering adolescents and young adults to take a very active role in their medical care. We think this is really important. We want to prepare adolescents and young adults for successful transfer to an adult provider. And one of the most important things, as you can imagine, for those parents or caregivers who may be listening, is we want to make sure that we assist parents and caregivers with facilitating their adolescence independence. Because we recognize, as we really get to know these patients and families from early childhood or even infancy, that parents and caregivers are really have really served a very primary role and have been the primary advocate for our patients along the way. And it can be challenging to make that transition to allow them to have more independence. And so our program is built to really assist and support parents and caregivers along with supporting the patients. So I'd like to just show you some of the components of our transplant transition program. And I'm going to give you some of the fine details in a minute, but just wanted to give you a brief overview first. So the program includes a welcome letter and an introduction. And this is really just to set the stage. What is the transition program focused on? What things do we hope to accomplish as we work alongside and support patients and families through this? There are 12 education modules that are part of the transition program. I'm going to show you a couple of those today. They focus on things such as medical knowledge, self-advocacy, insurance, all sorts of things. And I'll go through those in fine detail in a minute. These modules are intended to be delivered during the clinical time. So the time that we spend with patients and families in clinic, or these days, the time that we spend by telehealth as well. And because the modules can be shared across screens, we've been able to really transition nicely to do a lot of this transition work through telehealth, and we hope to continue to do that in the future. There are pre and post assessments, and I think this is really important because we want to make sure that as we start to support people through this transition program, it's really important to identify what things do folks really feel comfortable with already? So that pre-assessment can be very helpful. And then post-assessment is helpful because once we've gone through some of the education and had a lot of the great conversation and used things such as teach back methods, we want to ensure that the information is well received by the patients. And so that post-assessment can be very helpful and might even identify some areas where we should provide a little bit more support. All of these materials are developmentally and age appropriate. And so we have different categories. We basically have broken it down into different age groups. And so we have materials that are relevant and appropriate for 11 to 13-year-olds, 14 to 16-year-olds, and then 17 and above. As I mentioned, we try to enroll most of our patients as early as age 11. And this really just starts to get, everybody's feet wet a little bit about some of the topics and you start to have some of the good conversation about some of these, this education. And we build upon the education that's delivered for the 11 to 13-year-olds. So they get a little bit more in that 14 to 16 window. And then additionally, some more information and some more responsibility when they go into the older age range. And so it's a very nice program that really, I think, builds upon itself and successfully prepares our patients for their ultimate transfer to the adult side. So I'd like to give you just an idea of what the program looks like. This is the actual welcome letter and introduction to our transition program. And so I don't expect you to read the fine print here, but just to, again, give you an idea of how I think user-friendly this information is, but also how detailed it is and provides a relevant amount of information. You can see here this welcome letter introduces folks to the transition program and then goes through some of the education modules such as transplant knowledge, medication, adherence, risk-taking behaviors, what do I do to stay healthy, and then self-advocacy. and has some nice bullet points about the various things that we really try to emphasize for each of these education modules. So this is what patients and families receive once they are enrolled in the transition program at the beginning. And this also, as I mentioned, other than being a nice overview, is a nice springboard for some good conversation about what the transition program is going to look like. It gives us a time to really answer questions that patients and families may have as they start out in this process. So I alluded to the different transition modules that are included. These are the topics that we cover as a part of the transition program. So medical history, this is providing information about a patient's, as it relates to kidney disease, a patient's underlying kidney disease, reason for transplant, their underlying reason for transplantation, what things about the transplant are really important to know in terms of their history. Self-management is a really important topic, and so we cover that in great detail as part of the transition program. Medications and adherence, these are two separate topics. So we cover things like, why are your medications important? What's important to know about the dosing and the timing? Medication side effects, things like that. And then adherence is a very, very important topic as it relates to not only medication adherence, but adhering to other recommendations or guidance about making sure you get to clinic when you're supposed to, making sure that lab draws are followed up on in a timely fashion. Dietary recommendations, exercise recommendations, all sorts of things that we try to emphasize as it relates to adherence and how important it is to adhere. School and work. This is another very important topic because as you can imagine, if you think back to the age categories I just mentioned to you, our 11 and 13-year-olds are going through middle school. And so talking about maybe what that middle school experience is like and how they're handling their underlying disease and how they're maybe sharing that with peers. And then those things may be very different, or those conversations may be very different once they go into high school and college. And so school and work are really important. And under that too falls, as it relates to work, thinking about what folks are going to do after school, whether that's after high school or after college, and helping people to really identify and outline plans. Nutrition is another topic. This is important as well. Some patients may have some nutritional restrictions, and some we may be more, talking about just general good nutrition for good health and a heart healthy lifestyle. Insurance is another topic. And this, I think, is a very important one because for many of our patients, they have not necessarily been a part of the insurance conversations when they were younger. Their parents or caregivers or some other adult was the one to really take that on and support them and work through the insurance issues if there were any. And so we try to introduce the concept of insurance very early and then help people to understand what that means as they get older and to take on more and more of that responsibility for themselves so that when ultimately they transfer over to the adult side, they really have a good understanding and are ready and willing to take on that responsibility. Risk-taking behaviors. This is another really important topic. So this includes things like smoking, alcohol, exposure to other drugs, sex, and these are really important things that many of our patients have a lot of questions about from very early on. And so we try to very developmentally appropriate introduce these topics throughout the transition program and have a lot of very honest conversation about these things. Support system. I think this one is tremendously important because as we're talking about transition and adolescents and young adults developing more and more independence and taking on more responsibility as they go through the transition program, we don't want to ever lose sight of the fact that a support system is really important. And so helping people to identify what their support system is currently and maybe how that changes as time goes on. Depending on if they're living in the home or they're going off to college and now maybe have a different support system around them. And so this is another really important topic that we emphasize throughout the transition program. So I wanted to show you some of the education modules to give you an idea of exactly what this program looks like. So here you can see this is one of the modules focused on transplant knowledge. And I think you can appreciate that this is a very user-friendly document, one in which we really try to, at the very beginning, outline what are the goals. So what are we trying to accomplish as we go through some of this education? And then there's a section about why. Why is this important? And that also brings up some really great conversation. This particular topic here is on transplant knowledge. So you can see that the information below is on what is an organ transplant? How do I keep my organ healthy? Why is lab work so important? And then what is rejection? And so these modules really hit on some very key concepts. And you can see there's a good amount of detail here, but a lot of this also, as I mentioned earlier, is a springboard for additional conversation. So it might be that as we go through some of this, patients or families might have some additional questions that come up as we're, say, going through rejection. And so that lends itself to some really great conversation. This is another module here, which is on self-advocacy, so managing my healthcare needs. Again, you can see that we set out with some really nice goals at the very beginning, so we can set the stage for what we hope to accomplish as we work through this with patients and families. The why behind it, and then some of the information that's relevant here is what's the contact information for my transplant team. I need to be able to make sure I can get a hold of folks when I have an issue or something I want to discuss. Keeping track of appointments, keeping track of medicine. So all these things that fall under self-advocacy. Another module that I wanted to share with you is one that's focused on self-esteem. So how do I feel about myself? Again, you can see the goal, the why is right at the beginning of this, and then some very important things to know. And then what can I do? What can I do to take care of my emotional health? And so it gives some guidance around that. And again, many of these things that we go through probably then prompt a conversation a little bit more in depth as it relates to maybe something in particular that that patient is worried about or wants to discuss. And then where do I go if there's a problem? And I brought this one up in particular because I think you can see here that we also have a section on other resources, because many folks say, where else could I go to get some additional information on my own if I want to read more, if I want to sort of do a little bit more homework in between now and my next clinic visit. And so we include a lot of other resources and references for people to look at on their own, and then potentially to bring more questions back to us at the next clinic visit. I mentioned assessment a little bit, and so I wanted to show this here because this is one of the assessment tools that we use, which is directly sort of linked to the education modules. And so it's a nice way for us at the beginning as well as afterwards to see how folks are doing with these topics. What's everyone's level of understanding about why did I need a transplant? What's the name of my underlying disease or condition? And the hope is that, at the beginning, there may not be a lot of great understanding, or there may be a lot of questions that come up. And by the end, after we go through the education that's part of the transition program, our goal is that folks will improve how they're doing and really gain a great level of understanding. And so the post-assessment will hopefully shed light on that as it compares to the assessment that we do prior to delivering the education. Another important thing is, as I mentioned, is the role of the parents or the caregivers. And so we have some tools to support and encourage the engagement with the parents and the caregivers. And so we go through this with the parents and the caregivers in terms of each of the domains. What are their feelings about each of these domains and how their child is doing as it relates to the information. So again, looking at transplant knowledge, my child can state why he or she had a transplant. And so if there's some concerns that are raised, or we say, wait a minute, yeah, they don't actually have a good understanding of that. You can see there's a nice area where we can develop some strategies to achieve the goal of having a better understanding of that particular topic. So this is a nice guide to use for parents and caregivers as we go through the transition program. So I hope that gave you a brief introduction to our very comprehensive transition program for our transplant patients. All along, and even from the beginning when we started to develop this, we were actively seeking feedback on this from our patient that was included in our multidisciplinary team. And we have continued to seek that feedback as we've involved more patients in this transition program over time. And because I think hearing from the patients and the families is vital to this, and making sure that this transition program meets the needs of our patients and families. And if there are areas where there's something missing or something that could be enhanced, we want to hear about that so we can go back and really add to the transition program and really provide the best support for those that are included. So I wanted to share with you today a transition story from one of our amazing patients who has very successfully transferred to the adult side. And she was kind enough to share her story with us. And so if we could just listen along now, and you'll see the things that I have included on here go along with what she's going to discuss with us today.
Thank you for joining us today. From peds to adult, here is my transition story. I began with the Hopkins pediatrics team at age 11. What my time looked like was frequent communication with my nurse and doctors, a regimented schedule approved by my doctors and nurse that included blood draws and medication, an order that went well with me into my college years, a more crucial point than high school, in my opinion, because that's when I really began to enter the quote-unquote real world.
Let me just see. I think we're having an issue here. Let me try it again.
I stayed with the pediatrics team until I was age 22, well past my expiration date. But I wanted to be sure that I was mentally and emotionally ready to leave the care of a team that I had known since I was a child. I am a creature of habit. I began the process of looking for an adult doctor specialized in my specific care by conducting independent research, online reviews, and using the hugest binder in the world ever known to man that was provided to me by my Hopkins pediatrics team. The expectation was that I would begin to develop a plan and routine around my specialty care that was independent of my nurse. What does that mean? That means learning how to schedule appointments, knowing the exact names and doses of my medications and what they are for, and learning how to self-monitor and develop routines that would assist me well into my elder years. My transition into adult care. I first visited with a doctor that I had independently researched. That was not a good time for me. I did not feel comfortable at the first office I visited, and the waiting room was jam-packed. This was crucial for me because I felt like I was just another number in a queue. I knew I wouldn't receive the attentive care I deserved and would require, so I left and decided I would not go back. As such, I ended up staying within the healthcare provided team that was offered to me under my family health insurance. At the age of 26, I began the process of obtaining my own insurance. Applying for insurance is hard and difficult and confusing, but I wanted to remain covered, especially during this time. And I wanted insurance that would keep me within the same umbrella and with the same team I got as an adult. That's how effective they were. That's how cared for I felt. Since then, it has not been an easy or consistent road, I will admit that, frankly. That is the real world interference speaking again. But I felt heard and cared for by my team in a way that I was as a PEDS patient, and that was most important for me. My care. Some transition tips and tricks that I can give to you. Keep a planner, organizer, constant alarms, because the real world does frequently get in the way of your health, And this isn't even exclusive to people with health conditions, prior, existing, or not. Prioritizing your health often falls to the wayside of immediate, tangible emergency. Discipline. There is no payoff without discipline. I do not believe one can excel at any task without intentionally deciding to do so and laying the groundwork to do so. Maintain communication. Your adult care doctor and team are not going to be on top of you like your peds team will be, simply because they don't have the time to be, and they are expecting you, as an adult, to be on top of your care. Even if you think it is the smallest thing, never be scared to communicate with your doctor. If you are scared to communicate with your doctor, you are at the wrong doctor. Build a routine and relationship with your doctor and care team. This seems very self-explanatory, but it is a pretty crucial point. Your team cannot get to know your needs if you do not make yourself heard, so make yourself heard always. Date around. Sounds weird, but it is okay to go a different route with the doctor. That I learned very quickly on. Again, you should always feel like your team actually cares about you and that you are not just another number. And lastly, fill out that book. Complete those transition tips provided to you by your pediatrics team. A lot goes a long way. Thank you. Thank you for joining us today.
So I think that I'm so glad that she shared that with us. I think it really highlights all the goals of the transition program, and I think it's really tremendous to hear her serve as such a self-advocate and to feel very empowered as she transferred to the adult side. And we're very proud of how well she's doing. And the binder that she spoke of is basically the binder that contains all of the education materials some of which I showed you today, as well as the assessments, and is something that many of our patients take with them as they transfer to the adult side, as hopefully a nice tool for moving forward. So I'd like to just go back to the goals of our program, because again, I think the story that you just heard really emphasizes the things that are at the crux of our program. So this program is focused again on supporting and empowering adolescents and young adults to take an active role in their medical care, preparing adolescents and young adults for successful transfer to an adult provider, and then assisting parents and caregivers with facilitating their adolescents' independence. And so with that, I'd like to just end by sharing a great picture of our pediatric nephrology division that is a great multidisciplinary team that works together not only to help provide the transition support for our adolescent and young adult patients, but also great support for all the patients and caregivers and family members that we are fortunate enough to take care of. So you'll see here, this picture here includes all of our faculty members, our wonderful fellows, nurse practitioner, pharmacist, our great nurses, affiliated professionals such as our renal social worker, dietitian, child life specialist. We have a great research team, our fearless division manager, and our great clinic staff and office staff. And again, I can't say enough wonderful things about this group that have not only helped develop the transition program, but many other programs to support our patients and families. So I thank you very much for your attention to this seminar. I hope that you found it helpful, and I would be more than happy to take any questions. And so we can move now into the question and answer portion of the seminar. Thank you. Okay, so I see a question here. At what age does my child actually see an adult nephrologist? That is a great question. And to be honest, it's specific to different centers have different guidance around this. And so here at Johns Hopkins, we typically will transfer someone to an adult nephrologist around the age of 22. Although I will emphasize that We as our group here, strongly believes that there's a lot that goes into that question about what's the right age of transfer. And so it can be very specific for each individual patient. And so we really try to talk with patients and families about what's the right time for that transfer. Typically, it's around age 22, but again, we make it very individualized as best as we can. There are other centers that may transfer patients to the adult nephrology side around the age of 18. And so depending on which center you're at, if you're here, usually it's around 22, but it would be important just to speak with your individual provider because it may vary a little bit. And then the other question, who decides when it's time for my child to transition? And so I'm in terms of the transition process, we start that around age 11. And we really try to enroll everybody in the transition program, recognizing that everyone may have a very different pace as they go through the transition program. But the goal being that they really have all of the skills and the tools that they need to be successful for ultimate transfer around that age of 22. And who decides when that transfer actually happens? We talk about it as a team, all of us together. And that part of that team is certainly the patient and the family to figure out what the right time is. And so it's certainly a group conversation and a group decision. And many different factors come into play. Another question about, are all PEDS patients supposed to transfer by 13? So typically we would not transfer somebody by the age of 13. So for pediatric patients, we would definitely keep them under our pediatric care until most time until the age of 22 here at Johns Hopkins, and for some other centers by the age of 18. But usually at 13, folks are still followed by a pediatric team. As you may know, there are certainly a lot of pediatric specific things that we as pediatricians have, really tailor our care to. And so that's important around the age of 13. Another question, would my college-age child still be seen in the Children's Center? Good question. So again, it all depends on how old that person is and what their specific needs might be in terms of, which teams would need to be involved. But typically, and I can say I certainly have a lot of college-aged patients who tend to come and see me on their breaks, although right now we're doing a lot of telehealth, so I get to see them even more. But we do follow a lot of college-age young adults within the Children's Center. And again, typically up until the age of 22, but there could be some variation from division to division, but that's how we are within pediatric nephrology. How can I encourage my child to take ownership of their health? That is a great question. And not a simple one to answer. I will be entirely honest. I think that is really at the, that's what this transition program is focused on, is encouraging adolescents and young adults to take ownership of their health, because there are many different things I think that come into play. One is just trying to support and provide enough medical information so that patients really understand why it's so important to make their health a priority. And so that's where the medical knowledge education module comes into play. Helping people and supporting them to develop more self-advocacy skills and having more of those tools in their toolbox can help encourage someone to take ownership of their health. Helping them to better understand why it's important to take their medications and why adherence to all of the recommendations is important. And so I would say to your question about how to encourage your child to have ownership of their health is to really try to approach it from all aspects and to try to get them involved in some sort of transition program to give them the tools they need to be successful, because it's not an overnight thing that can be done. And so the other thing is having a team that works alongside them with you to help to develop a lot of these skills and support your child along the way. Another question, will the adult nephrologist be at Johns Hopkins? So good question. That is up to our patients and families. And so when we start to get ready for the ultimate transfer to the adult provider, we talk with folks about what it is that they're looking for in terms of an adult provider. Do they live closer to the Hopkins area, and so do they want to stay within the Hopkins system, versus is it somebody who lives many, many hours away from us and has been coming to see us as pediatric nephrologists, because we're certainly, there's fewer of us in the area, but now there might be an adult nephrologist that's closer to home for them, or closer to their college if they're in college. And so they may choose to see a different provider, but many of our patients stay within the Hopkins system. And in that situation, I find it quite nice because we are also able to talk with our adult nephrology colleagues leading up to the transfer. And so we can share a lot of the information that we know about our patients and families as we've gotten to know them often since birth. And I think that's really important to be able to pass that information along to the adult side. And when it's one of our adult nephrologists here, we're more easily able to do that. We certainly can do that with all physicians, not even those at Hopkins, but I think we have some really great conversations with our adult nephrology colleagues. And you bring up a good point too, because when I was talking about our multidisciplinary team that developed a lot of this transition work, we also have had input and will continue to have ongoing input from our adult nephrology and adult transplant colleagues, including transplant coordinators, because they're looking through a different lens than we are on the pediatric side. So we want to make sure we take that into account as this program continues. Another question about how many transplants can a child have? Great question. And I think that is, you can have multiple transplants for sure. And many of our patients have, especially if they were transplanted when they were quite young. And so I can't give you an absolute number, to be honest, and it really would be specific to a particular person in terms of what's going on with them and what their needs are for future transplants. And so I would leave it to say that you can certainly have multiple transplants, but I can't give a specific number because it is really sort of very specific or unique to an individual patient. Another question, I am nervous to come to Hopkins because of COVID. What safety precautions are in place? Great question. And there are many safety precautions in place. And I can tell you that I've been, from the beginning of COVID, have been here at work, both on the inpatient and the outpatient side. And we, within nephrology and within the entire Children's Center, have continued to see patients in whatever way folks feel comfortable, whether that's coming to see us in person, where we have many different screening measures in place. We've not only screening of the providers, but also of the patients and families. We've spaced out our clinics so that there's that we try to minimize folks that are waiting in the waiting room, really bring people back to the clinic right away, spacing out the actual time so that there's not overlap of patients and families. And then we have certainly adequate PPE that we use with every patient encounter, both inpatient and outpatient. So many, many measures that have been put in place that make me feel very safe here at work. And so we have continued to see patients in person, as well as, like I said, if someone prefers to be seen by telehealth, we are doing a fair bit of that as well, because we recognize the importance of making sure that the care that we provide all across the Children's Center and within our division of pediatric nephrology does not slow down in this unique time where we are today. Another question, will my child be on medications for the rest of his life? And I'm assuming that this is as it relates to someone who's undergone a kidney transplant. And so that's a great question. And the answer is yes. There are certain medications that help to sort of lower the immune response that are really, really important for our transplant patients. And those are medications that individuals need throughout their lifetime. Another question, can my child get kidney dialysis at a location near my home? Where are your dialysis clinics? Great question. So in terms of pediatric dialysis, so we have the only pediatric dialysis unit in the state, and it's here at Johns Hopkins on our main campus in East Baltimore. And that is our that is our only dialysis clinic here. For hemodialysis, that is. There's a different form of dialysis called peritoneal dialysis, which is a type of dialysis that is done at home. And we have many patients that do that. And those patients come to see us once a month, and we're doing a lot of that by telehealth, but the actual dialysis is done at home. And so that might best answer your question there. Some of our older patients, our older teenagers and young adults, certainly may be able to get dialysis at an adult center that's closer to their home. And so I'm not sure the age of the patient that you're referring to, but if it was somebody who is older, there might be, if you were interested in having something closer to home, there may be other options. But our dialysis unit here takes care of children from very young up until our young adults. And we have a great multidisciplinary team there, which I didn't necessarily highlight today for this seminar, but one that really does a phenomenal job helping to take care of those patients on a day-to-day basis. Next question is, after surgery, how often would we need to come in to see you? And so I'm assuming you're asking about after a transplant, how often would you need to come in? And so we follow you very closely in the beginning, and we see you at least every week in the beginning, sometimes more. It depends how things are going, and we get pretty frequent labs in the beginning to make sure that your kidney function is looking good and that the levels of your medications are also in the spot where they need to be to keep you healthy, to keep the kidney healthy. And so we see you weekly for a period for about a month or so, sometimes a little bit longer. And then we start to space that out based on how someone is doing. And so over the next, several months post-transplant, that gets spread out a little bit, but you do see us a fair bit in the beginning. And not only seeing the provider, someone like myself, but also seeing our team. So someone part of our transplant surgery team, our pharmacist, our behavior psychologist, our social workers, our transplant nurse. You get to really have a great team approach to those visits to make sure that everything is going well. The next question is, what is the average list time to get a kidney? So that is, again, sort of a very specific question based on an individual in terms of what their background history is. And I can tell you, though, just from a pediatric versus an adult perspective, kids tend to have a shorter wait time as compared to adult patients. And so I can hopefully answer your question with that. But it is sort of very specific to each patient, more on the order of months to hopefully short number of years. Next question is, since you've been in practice, how long has a kidney lasted that you've seen so far coming from a parent? That's a great question. And gets at living donation versus deceased donation. But we have one of our former patients who's now transferred to the adult side, I believe I'm losing track of my years, we're in 2020, has had his kidney for, I think, 27 to 28 years so far, which is pretty incredible. And I was not here at the time of his transplant, had come on board for my training after that time. But one of my colleagues cared for him when he was in the pediatric center, and he continues to keep in touch with us and continues to be a big part of our transplant reunions that we hold every few years here at Johns Hopkins, which is really a nice time to bring back patients and families and to celebrate the successes of their transplants. So I would say he is the longest so far. We have many others that are getting up there too. And I think this is probably the last question here. Will my child be able to play sports and do the things they love to do after surgery? That is a great question, and one that we spend a lot of time talking about, and I think is so important in the pediatric world, right? Because our patients, really love to stay active, love to engage in all the things that the things that they did pre-transplant, they still want to do post-transplant. And we are here to support them in that and to find unique ways to hopefully make each of those things happen. Um, Early on, post-transplant, we do have some activity restrictions in place for sure, because we want to make sure that folks heal very well and that the kidney stays nice and healthy early on. But then from that point on, we really talk with patients and families about what things they want to get back to. And sports definitely being one of those, because we encourage people to lead a very active and healthy lifestyle. And so many of our transplant recipients indeed play sports, multiple sports. And we work with them to make that as safe as possible, whether that's something like supporting them to wear a kidney guard if they're interested in that, talking about the importance of staying hydrated when they're playing sports, and talking about what things they need to be mindful of that maybe some of their peers don't necessarily have in the back of their mind while they're playing. So yes, we do our absolute best to get people back to all the things that they enjoy post-transplant. And a big part of that too is having engagement with our behavior psychologists to identify what those things are that are important, and to help people include all of those things that are important to them post-transplant, and to not lose sight of those, and to really get back to that and lead a nice, healthy life. And so our multidisciplinary team works closely with people post-transplant around those topics. All right, so great questions. Thank you. I appreciate all of those, and I hope that I provided you with some good answers. I am more than happy to answer other questions, I think, as was alluded to in the beginning, and as you'll see here, if there's any additional questions that you have, or any if you want to hear more about our division and the wonderful team members that we have, or certainly speak with any of us or set up an appointment moving forward, I think the information that you see here on the screen is the best way to do so. And we would look forward to engaging with you more and hopefully meeting you if you have needs. Okay, thank you so much. I really appreciate your attention today.